Okay, just so I know who and what is recording, who is planning to record the meeting? Okay. So, I give my consent to being recorded. I do not give my consent to sharing this information publicly. So you are not allowed to share this with reporters or public information because that again is against the state guidelines for open meeting records. Does that make sense to everybody? Please make sure your recorders are on and hearing that. I am not quoting via media. I'm giving information to you all that you're welcome to share privately amongst yourself. You can even send it to other scholarships students. It's totally up to you, not to the press. Hold on, I saw another hand up right.
Yeah, that answered my question. Thank you.
Yeah, no problem. Yes.
So then for like the notes being sent out later, that we can share with everyone?
So Biz, can you take notes, Ben? Then I'll take notes and send it directly to you all's hall. And then if there are other people who would like that, they can ask Ben for those notes, but we're sending the information and communication because it deals with your sleeping torches to you all. Yes.
So whenever someone from Miller or Watkins is speaking, if we do give our consent for that part specifically to be published, is that allowed under Kansas law?
No, because I'm in the recording too, so you can't piecemeal out the recording. If you all are wanting to give documentation to the press, you need to do that on your own, not using this recording, because you're recording the meeting. Does that make sense? And this is not an open meeting. Does that make sense? So if you want to talk to reporters, you're more than welcome to. My hope is that we can get this resolved and be on the same page, but you're welcome to share your thoughts and feelings, but you can't do it using my words. Make sense? Okay, let me just grab my phone here. Are you all ready to get started?
Yes.
Okay, so, good evening. My name is Dr. Ernest Watson. I'm the Associate Director of Residence Life, pronouns she, her, hers. I've been direct supervisor. So I worked at the university for almost 6 years now, and I've met many of you all through lots of different other processes. First of all, I'll start with an apology. So, it is never the intent or direction that when we engage in sharing information that we marginalize people or marginalize you all's voice. I know that you all feel that way, and that's not the intent. The intent is to give information as soon as we have opportunity to share it. What has happened is a breakdown in our system, and so my hope is that we can talk through how to address that breakdown, make sure everybody walks away with some understanding, and that your situation feels like it's been addressed to the best of the ability. So, let me start with some kind of bigger picture pieces, give you the overall of where we're at right now, and then I will answer questions. Does that work for everybody? Okay. Bear with me. As you all know, talking to mass takes a lot of breathing and lots of engagement, so hopefully I won't go into a coughing fit during this, but if I do, just bear with me. So, a couple of things. Our goal is to get Miller and Watkins back to pre-COVID occupancy. There are only two ways to do that. One is the sleeping porches. Another one is by adding beds. So if we go through the pieces of, we need to get you all back to pre-COVID occupancy, that's what the goal is at the end of the day, is to allow more students at the end of the day to have the opportunity to live in Miller and Watkins, so that folks have that opportunity. So the scholarship halls, I can share with you all as far as addressing kind of COVID pieces. You all have done a fantastic job at protecting yourself and engaging and being vaccinated. As we look at where COVID is right now, we can't predict where we will be in 6 months from now. What we can predict is that likely a lot of things will change in between now and August as it relates to the university and how and what COVID engagement looks like. So part of our rationale is to be as forward-thinking as we possibly can with that, to prepare that we will be in a place where we can utilize sleeping porches. We hear you that it seems sleeping porches are not the option that you all want to go with. So with that in mind, the alternative, like I said, is looking at different spaces of where we can add additional bed spaces to even out the impact of COVID. So what that looks like, I think there's a lot of room to work with you, similar to what we did 2 years ago when we first started this, to talk about, okay, this space can be a triple, this space can only be a double, or this place can only be a quad. Like, we can definitely have those conversations if the overall pieces, we absolutely can't go back to sleeping porches next year. The question I would want to ask is this sleeping porches never? Or is it just sleeping porches until end of COVID? I'm not ready to take questions, just hold on just a second there. So that's one of the things I'd like you all to consider is we don't know when this pandemic is going to come to a full stop in. And so what would be helpful for me to know is if we're talking sleeping porches are not where we want to be and we don't want that tradition anymore, which would be helpful for us to communicate, then we can start space planning in the future. Or this is primarily about COVID, and that's where the not one of sleeping porches comes from. So those are kind of two areas that I would love to get opinion about and better understand kind of where the fervor is coming from. The other piece is, if we land on the sleeping porches after this meeting and you decide that you don't want to live in Miller and Watkins, there is no financial impact to you in regards to fees. So you didn't pay the fee, you're not going to be charged a fee if you break your housing contract. You just need to do it before June. Our fees are split into for new people and returners. You all are on a different timeline. So if you're thinking back to when if you were a first-year student who engaged and you paid a $50 application fee or you paid money, that doesn't exist for you as returners. So all you're doing really is saying you don't want to live with us. If you're saying I don't want to live in Miller and Watkins based on kind of the unknown or whatever we decide on, we will help and work with you to find a different place within the system. We've got until the 20th of February to kind of figure out if you'd like to go to another space, if that's what you want to do. My hope is that we can land on what people want that fits the work for you. We've got space and time to do that. So I think I've answered or addressed the larger picture and where we're at. If there are some larger picture pieces that would be helpful before I start taking questions, just shout out that topic and I'd be happy to address it. Does that make sense to everybody? So is there a pressing topic that I haven't covered that people would like me to? Yes.
A COVID plan.
Sure.
Say we go back to sleeping porches. I am a healthcare worker. I work with hospice patients. Say I'm exposed. What happens?
Yeah, so our COVID plan would stay the same. So what we're doing with residents right now is that if you're vaccinated and you've been boosted, all of those things, we're not asking you to quarantine or to go into isolation. That is the CDC standard at this particular point. If someone is testing positive, we would pull them from that community and they would go into isolation. So we move beyond based on CDC guidelines from having individuals who are not boosted or boosted or vaccinated from having to quarantine. Does that make sense? So we're no longer looking at a situation where if someone was a close contact in that situation, where we would have to have you isolate for 10 to 14 days. So we work that out both with Watkins and our healthcare professionals to understand what we can and can't do. And so as far as that exposure of what it looked like a year ago, it looks completely different. Does that answer your question?
Yes.
Yeah. So it looks like I'm taking questions now. Are there any other big topics that I could focus on before I take questions? Yes.
Just sleeping with the masks or sleeping without the masks, I guess is one of the.
Yep. So do not foresee you all sleeping with masks. That would not be an expectation. I think again, if we're looking forward to where the world is going right this moment, the likelihood of us having a mask mandate in August, it is pretty slim. We see other states and other countries getting rid of masks. I don't and can't predict that, but I do believe that this campus will look different based on the information that is being shared at a higher level with university planners, that the mask mandate will look very different. So I'm not saying it's going to go completely away, but us doing this right here with masks in this kind of meeting, I don't know if that's going to be the case. So I can definitely probably say we would not have you do masks. You all are already eating together and engaging differently with masks. So you all aren't eating, I know you have your separate kitchens and things.
Majority of us do not eat together. There are
One.
fewer kitchens with home style kitchens that.
One.
There's one home style kitchen, at least in Miller, that eats together, and that's how many people? 5, 6?
I think 4 or 5.
And
Five.
It's like 6. So maybe the clarification is, you all know you can eat together if you want to.
Yes.
Does that make sense?
Yes.
That's what I'm saying. So 2 years ago, it was you all couldn't even do that. Now you have the opportunity that if you do want to eat together, you can. Yeah. I'll come back to you and take this question. Yes.
So, we all know that COVID is very unpredictable and we can't predict it, but it seems to me that you guys are predicting the best of the outcomes and preparing for that, whereas that's what makes me feel uncomfortable, because nobody predicted for COVID at all. We all thought it was gonna be 2 weeks, and here we are 2.5 years later. So I'll be honest and say that it feels a bit irresponsible to plan for the best when so many people have died from COVID, and many of us work as healthcare workers. I work with children, children small enough that they cannot get vaccinated, and I have seen children in the hospital. So to have sleeping porches feels a bit precautious to me.
Okay. And again, the option for not having sleeping porches is on the table. We just need to know how to get the rooms situated. So if that is a thing that you all want to do, would like to hear options of where you all feel like we can add more space. So you were next.
So just a clarification for the mask mandate,
Yep.
that is not made by you or Ben?
Correct. The mask mandate is by the university and by the state. So when a mask mandate, and that's an excellent question, I think there are some misunderstandings about who is enacting mask mandates. So mask mandates come from the state and from the county. So one of the things that you all know is that if you go to the left or right of us, if you go to Topeka, there is no mask mandate. If you go to Overland Park and Olathe, no mask mandate. They are still part of Kansas. The state of Kansas does not have a mask mandate. The county of Lawrence, Douglas County, has a mask mandate, and the city of Lawrence has a mask mandate. But even if the city of Lawrence and the city of Douglas has a mask mandate, KU can decide at different points whether or not they want to keep that mask mandate or not keep it. And that is made by the Protect KU Pandemic Council, not individual to housing. We have a say sometimes, but that is not my call, that is not Ben's call, that is not our department's call. Make sense? Okay, yes.
So I want to state how my whole is feeling since our whole meeting on Sunday. I cannot speak for mother at all. After hearing about the sleeping porches, we have a lot of concerns, especially with COVID safety, and my proposed solution is that during room selections and maybe bed selections, we and housing do not plan on filling the house at all. Like, we can select our beds, so if in August, we'll have the sleeping porches, but if COVID cases spike again, then the sleeping porches will not be part of it, and Miller can just not have sleeping porches like they want. And then if COVID is better, we can fill the house like after we know that it is safe. And you mentioned putting beds in like the 2-person rooms on the second floor right now. I don't know if you've been into Miller and Watkins recently. Those are incredibly small rooms, and I think it is downright cruel to put another bed into those rooms because people will have no space to actually live. I think that is a heartless suggestion, and I do not think putting extra beds is the answer. And as far as Watkins, things about the sleeping porches, it's just a COVID concern. We do want them back once it is safe.
Okay. So let me address a couple of things, and I'll take questions from other people. So I think one of the things that is important for you all to understand is that we operate on a timeline for people to sign up. So it is unrealistic for us to find 25 additional people that would be willing to move in at that point when we would be able to define or understand COVID to that precise level that you're talking about. So students are done with orientation in early July. And by that time, students have already selected their room, they already know where they're going to live. So that's why we're trying to make these decisions now so that we can have space for new students to move in and have them make those opportunities or have them make those decisions. If we wait that late, those students will either A, decide to go to a different institution, not live in a scholarship hall, or not live with us at all, because we wouldn't be able to open those spaces. So I hear that suggestion. I think we have to firm that up a little bit if we're gonna do that with a quicker timeline. Not saying no though. Make sense? Okay. Yes.
I have like 2, 3 other questions.
Yeah.
One of them is, obviously, we have handled going below capacity this year. I know that it's been something that we've been okay with. Why now are we pushing for full capacity? It doesn't, from a 19-year-old standpoint, from our standpoint, right now, it looks like you guys aren't stressed about our community. I've built an amazing community with the limited capacity. It almost looks like housing is more concerned about the money coming in than our actual safety. I know, I talked beforehand, and I know there's been things around campus, that's part of it. We are the lowest income housings. And it's not, you're not gaining anything from us anyways, necessarily. So what's the point of making more people come into it and putting us in a bad situation? That's my first question, why capacity? My second question is, at least for Watkins, we feel more comfortable knowing our girls are vaccinated. They are boosted, they are safe, we protected it. I know that KU makes it so that meningitis shots are something that are required. And I know that in some places, especially new healthcares, new law firms, private institutions, they're allowing for their housing to make it so that you have to have a booster. Is that something feasible for us to feel safe in our homes? That it's a right to live here, we expect you to have this, this, and this.
So let me address the easy one first. So as you all know, the legislation that exists in this particular state and what COVID vaccinations and discussions, hopefully you know what that is like at the state level. The state decides what we do in regards to mandates. We are a state institution. So KU cannot, at this point, particularly if you all are familiar with the federal case that happened a couple of months ago, anyone familiar with the federal case on vaccine mandates for state employees? So that swims in the same area. Because you are a state entity, we can't go above and beyond. So meningitis is looked at very differently politically than COVID vaccines. And so I think if you all are wanting a COVID vaccine, again, housing is not rogue in this situation. We don't make that mandate, the university does. I would highly encourage you all to engage in larger discussions with your student representatives and student government, and engage in those discussions on a larger picture, because that is not a university solo decision. That is a state decision for mandates and vaccinations to require people to be COVID vaccinated. As you all can see, kind of the larger pieces of that has so many different tentacles. That wouldn't be a housing only decision. I wish I could tell you.
Then is it something allowed for housing to make it so that, and I know this because I know like the rec center, for instance, lost a couple of employees because they were trying to mandate and it didn't seem that it could pass. Is that something where we could do, if you have your COVID vaccine and your up-to-date booster, you're allowed to move in, but if you don't, you have to get a negative test and continuously test?
Yep. So again, you're talking about university capacity in regards to having testing facilities, being able to do all of the things that you're talking about in regards to being able to require people to test. We can't make a mandate that is only required by some, not all, particularly as we talk about COVID, which is unlike meningitis. So a clear example, so meningitis. Meningitis is something that is a communicable disease that is specifically associated with and has been part of an on-campus community. That's why housing operations say meningitis shots are required, because we've seen the engagement that meningitis in regards to living simply in on-campus unit has had. That's an old school practice that's been around for years in regards to meningitis. COVID, because it is not associated with living on campus, it can't be a standalone vaccine for only on-campus students. Does that make sense? Because everybody has to be treated with COVID the same. And even though the rec tried to, it sounds like, allow or have people be vaccinated, my guess is that they had to go the same way as the regulations federally, that they couldn't. And we're still beholden to those regulations. I hear you all, I support you all in engaging in vaccination advocacy. It is not a housing decision. We can't change that policy. If we could, please know that we would do everything in our power to engage that. Critical questions on this campus are being asked about that. Me as an immunocompromised individual, I ask those questions every day. And so I think what's helpful is encouraging you all to talk to your advocates, your student government leaders who have a year of multiple different people. That is where sometimes change comes from. But housing is not in charge of vaccine mandates on campus or only allowed to make vaccine mandates for students on campus. Make sense? Okay. Kind of lost track of the questions.
By capacity.
By capacity, great question. So I think there's twofold. One, we would like to get you all back to capacity because there are people who need the lower rates of Watkins and Miller who don't have the opportunity because we've been at lower capacity for almost 2.5 years now. If we keep at this lower capacity, that means less people get that opportunity. So eventually, we've got to make that decision. So if it's not this year, then it needs to be the next year. And so what we need to understand is how do we get there? How do we get there in pack? Because we want people fully to have this opportunity. As you all mentioned, you all are the lowest cost scholarship hall. We want more people to have this opportunity. When we cap this and cap you all, it pushes people to a higher price rate because you all love these communities. I've seen it for years. I was a student here. I know you all love these communities and have some of the best communities. We want more people to experience that. And we don't want to do it at the risk of others, but we do have to make some business and financial decisions to get there. And so timing is everything. We've just got to figure out what timing looks like. Yes, and then I'll grab some questions over here.
Okay, so I'm a little confused because, so you're saying you want us to like put us back to like how it was before, like back to normal. Obviously I think it's a little soon to like, because we all want it back to normal. Like we want everything to be back to normal. But the fact is that we're not there. So I'm just confused. Why do you think that we are going to go back to full capacity once you allow it? Like what makes you believe that people do want to sleep in sleeping porches knowing the potential risks? And like why do you believe that we are going to achieve full capacity if you let those back? Like do you think people are willing to take upon this risk? Because clearly this room is full of people that don't want to take that risk and have already considered moving out.
No, I think that's a fair question. I think all we can do is ask and try. So what we've learned from you all is that we've got to give people more information ahead of time, and so this gives us several months ahead of the new students to be able to share and have to make decisions about what they want to do. I think that is important for them, even though we don't get to do anything with you all to give them that information. And so people will decide. And if we find that we can't fill to capacity, then I think that gives us our information and our question of whether or not that decision was the right one. But I think if we give people the choice, do I think people are wanting to live in North Watkins? Yes. I think there is people that are willing to live with the sleeping porches. But again, I'll reiterate that we don't have to do sleeping porches. We just need to figure out some other ways to get to capacity.
So what if that's their only financial decision? Like for me, for example, that's like I can't really afford to like live in Daisy Hill because it's so expensive. And this is the only chance I get to have an education here at KU, and that's the only place that I could live in. And I have to, it's not my choice. I have to abide with the sleeping porches because that's what KU housing decides. So I have to put myself at risk in order to have an education. So I'm like,
Yeah.
Is that a fair choice to give to people?
I think it is where we have to work with individuals. So one of the things I would probably ask is if we can work with you individually on what your situation is and can we engage one-on-one. If, again, we get to a point where you all are saying no sleeping porches, then we've got to figure out a different path in a different way. I'm very open to how we do that and how we identify and work with you all. I'm going to take a couple more questions.
Okay, thank you. First question I have is who specifically made the decision and why was Watkins and Miller's kind of uneasiness, disapproval not taken into consideration with the decision of sleeping porches?
Yeah, so I think that there was some miscommunication in regards to a conversation that was had with Sarah Waters in October about the sleeping porches and whether or not that information is shared. So I think there was a misunderstanding, and so that is my job tonight to kind of clear that up and give you all the opportunity to share and speak. So again, I apologize that that was miscommunicated and that you all didn't have the information from those earlier conversations.
I also have a follow-up. So
Yeah,
you
absolutely.
have expressed you are an immunocompromised person. There are multiple immunocompromised people in this room. As you said earlier, this right here that we're in is kind of iffy for next year. So you see where our concern lies with sticking a bunch of people in a even tighter packed room without masks on. So I guess, how is that logic lining up?
So I think when we think about, are there spaces within you all's area that we can identify that would work for more and higher bed capacities? I don't think it's an all or nothing. When I think about, can we walk through your halls, re-identify some spaces like we did 2 years ago in regards to, are there some ebb and flow pieces, and working with you all to identify that. That's what we did when we landed on going into individual rooms versus the sleeping. Yes.
So I have a few points.
Sure.
So per the KU housing book, I think it says that residents have the right to live in a clean and secure environment, and that residents are prohibited from engaging in behavior that pose a public health risk to themselves or others. The logistics of having sleeping porches and consequently, not sleeping in masks and having everybody grouped together does not feel like a secure, a safe choice, and it does not feel like a responsible choice towards public health. According to the CDC, Douglas County is of high risk of transmission, and because of this, the rooms were implemented during the start of COVID, and because of that, in 2.5 years, there's been around one positive COVID case, or one positive room of COVID cases. So obviously the rooms are working for us, COVID-wise, and it feels a bit dismissive to say that you guys are hearing us, because we have been talking for a while, and it took this long for us just to get face-to-face with you guys. We have been asking at every meeting when the sleeping porches were going to be decided. We have been saying that we are uncomfortable. We took multiple polls where the majority of our residents feel uncomfortable with sleeping porches, and we voiced that. Nobody heard us. To make students sign the contracts before a decision being made feels a bit shady. It doesn't feel transparent, because it feels like you are trying to force us to decide whether we need to live at Miller or not, when that's not really a choice for many of us, because it is the only option for us price-wise, because a lot of us are low income. And living in Miller is not really a decision. We cannot afford apartments, we cannot afford Daisy Hill, and we cannot even afford other scholarship halls like Sellards and other things like that. Miller is the most affordable hall, as is Watkins. And it also, and I can only speak for myself, I am not going to speak for the entirety of Miller, but the decision of the goal being to get us to capacity definitely seems financially driven, and it seems like you are putting us at risk and sacrificing us to be able to have more money, and that's doesn't feel like a fair choice to make when it's our lives and health and well-being are at risk. I'm glad that if the contracts are canceled, there will not be a fee, but it's not even necessarily about the fee. Like I said, what about housing? Where are the people who can only afford Miller and Watkins live when they're immunocompromised, when they feel uncomfortable, when it seems like we have been disregarded? We have been talking to student governments, we have been talking to officials. The people who have not been listening and we've been trying to talk to is upper housing. And you guys have a responsibility to protect us, and to provide an environment where we can feel safe and we can be healthy and we can continue our education. And the implementation of sleeping porches doesn't do that. A lot of us are so uncomfortable. Most of us are uncomfortable. As you can see, this room is almost filled. The other people who are not here are probably at an event, and that can tell you about how much we care about Miller. We want to stay here. We need to stay here. And I think we've all done our part to uphold, protect KU. Doesn't feel like you guys have. It seems like the minute that it becomes about finances, our health and safety is being thrown under the bus. So my question is for you, when are you going to show us that you are actually hearing us?
Sure, so I think it starts with this meeting. I can't speak to what communications were happening before, but I'm here, I'm listening, I'm taking information, I'm doing my part in regards to listening. And as I said, a couple different ways, I'm willing to help and figure out and share with my supervisor where and what you all are looking for in compromises.
And I have a follow-up question just to that. I also would like to know the logic behind something that recently happened to me. Within Miller, I attempted to move in with my two best friends, where there is a 3-person room, and one of the beds was vacant. I put in a move request, you know, the whole thing. And when I called, I was told that I was denied because having 3 people in a room was a COVID safety risk. And that makes me a bit confused how 3 people in a room is a safety risk. And by the way, there is already 3 and 4 people in a room at Miller, and 25 is not.
Sure, I can't speak to what the employee said. I wasn't there for the conversation. If you'd like to tell me who you spoke to, I'd be happy to follow up. We've had a couple of different folks that have started new in the office, so that could be someone who has misinformation. But I am not aware where that would be a COVID piece, and if we need to get you changed in rooms, we can do that. Does that answer your question?
Yes.
Yes.
We obviously are hearing you say you're hearing us, and we understand. The bottom line is that you want capacity back, and we understand that you are giving us 2 options. Neither necessarily are the best options. I'm going to speak on the filling capacity with the rooms that we've got, trying to find space for these people. Little personal information, I live in room 205. I love her. She's amazing. She's the smallest goddamn room in Watkins. And I live with me and her. And we physically cannot fit another bed in that room. We physically can't fit another bed in their room. We physically can't fit another bed in 4 of the rooms on our floor. And the same thing with the 3rd floor. And you want us to have enough in a proctor. Those are extra people in us. There's no more room for beds unless you're bunking it and making us live like mice. It's just, it's not, it's, and sure, and we get that you hear us and we understand, and obviously, I'm guessing you have a bed that you sleep in at night and a room that you enjoy, or you're going to be paying to live there. But it's not, it's going to come down to capacity is not an option right now. It's not something that makes sense. Sleeping porches, it's not something that makes sense. COVID, it's not something that makes sense with the way that our house is built. It doesn't. And we would love, I know that many of us, I'm guessing Miller and Watkins would love to make it so that you can go through the rooms, you can look at our stuff, you can look at how things are, you can see the way that we're organized it. It's just, we don't have, there's no place to put more people.
Okay, I'm hearing that. Yes.
So for the amount of closets in the hall, that's the amount of people? Okay, so
What, say that again, for the amount of closets?
closets, that's the amount of
It's
people
not a
in the hall?
one-for-one, though.
It's not, okay. Is it possible that, like, we fill the rooms to how many beds per closet, so that every person who's in a room has a closet?
I think that would take your density down even more. Yes. It would be less people you all are talking about.
Okay, and then
At least
for,
10 less people, I think that's.
The mask mandate, if our mask mandate for our hall was dropped, would that be, if, that would be dropped all around KU, correct? Oh,
Yes and no. So there are instances where the university will have and drop their mask mandate, but as communal living, we would keep it. That did occur at different points last year and the year before. We would not do it house, hall by hall, or community by community, it's either hall or no.
okay, so if we were to drop, so if we were to sleep with our masks on, we would have our masks off, or if we were to sleep with our masks off, we would probably not have them at all, right? Like the mask mandate wouldn't be there.
So I'm working under the impression that you all would not want to sleep in masks. Is that what folks are
Yeah.
saying? So your question, I just want to understand it correctly.
So what I'm asking is it just, if we're sleeping without masks on and we're in a room with over 20 people against the CDC guidelines, then the mask mandate would have to be dropped for all scholarship halls.
Throughout the entire house, I think is what you mean.
So if we're sleeping without masks, does that mean we're also hanging out in the living room without masks? Does that mean there's no mask mandate for our house at all?
So there's either a mask mandate or there's not. You don't have mask mandates regardless of individual sleeping quarters. If it's a sleeping quarter, you don't have to wear your mask. That's how that would work in that instance. Does that answer your question?
Well, so would that mean like cellars wouldn't have a mask mandate too?
So it's all or nothing with the mask. If we went to sleeping porches, you all would not have to wear your mask because that would be considered, for lack of a better word, a no-fly zone, like someone's internal bedroom. The community itself and housing can still have a mask mandate that says that you would need to wear your mask in the living room or on the study porches, but not when you're sleeping. Does that make sense? Because we don't require people to have masks in their individual bedrooms with two roommates. So two roommates over and down. Those two roommates that live in the same room are not wearing masks when they sleep. Does that make sense to everybody?
Oh, so sorry, Alex, you correct me if I'm wrong. I think you're misunderstanding the question a little bit.
Sure.
I think what they're asking is if Miller were to not have a mask mandate within the house, right? Does that mean that other scholarship halls wouldn't as well and other parts of housing wouldn't?
No, it's
So
an
we
all or
wouldn't
nothing.
do a mask mandate by hall. It's either everybody has a mask mandate or nobody has it.
Got it.
So you all would not be able to opt out or in. It's
Mhm.
either campus has a mask mandate or housing has a mask mandate or we don't.
So the
Okay.
entire campus would not have a
Entire
mask mandate?
campus,
Okay,
yes.
so no, regardless of where we were moved to, there would be no masks.
Possibly if that's the direction the university goes.
Okay.
Does that make sense to everybody?
Yeah.
Yes. So you could live anywhere. That would go for your classrooms, that would go from anywhere. Where there might be nuance, and where there has been nuance before, is if we felt like based on a living community as a whole, we're saying you absolutely need to wear masks in KU student housing. But we rarely, I think I can only count to one time in the last 2 years, where we haven't aligned with the institution's mask mandate. We rarely have done one, not the other. Okay, I'm trying to keep track of questions. You've had your hand up for a while, yes.
Yes, I have a concern with the sleeping porches in general as a concept because, you know, people who tend to be lower income tend to have gone through more hardships, more struggles, which causes trauma, as we know. I'm a psychology major. That can cause insomnia, that can cause nightmares. There are people who are LGBT who are low income and trans, I'm trans, and that's not a great situation when it comes to sleeping porches, considering that you will have no privacy. If you wake up with a nightmare, everyone will know about it. And I'm sure that you wouldn't appreciate that if it was you having a nightmare, you know? So why, like, it just doesn't feel logistically, like you're wanting people who have lower income to have an opportunity, but you're also cutting out a whole, like, group of people because they do not want to live in a sleeping porch.
I mean, that's always been the case with Miller and Watkins, is people not wanting to work on the sleeping porches. When I did tours and different pieces with orientation, you always have to explain the sleeping porches and what it actually means. And so I think that gets to the larger picture question that I asked with the earlier part of the meeting is, are we talking about no sleeping porches from here into perpetuity or COVID. I'm hearing kind of two. And we definitely don't have to make that decision today, but I do think that that is something that, so that we don't continue to go round and round on the conversation, that if you all are saying adamantly, we don't want sleeping porches and we feel like that is an issue for individuals, that is a different conversation than kind of the COVID concerns. Does that make sense to everybody? I think we can have them in parallel ways, but my goal today is to walk out with what would you all feel comfortable with for this upcoming year. And then I think we can schedule some time later on this academic year to discuss whether or not the sleeping porches ever come back, because I think that is a bigger piece of the puzzle, because that would bring you all to capacity forever as to what you're standing at now. And so I think that is a bigger question that I would love to pull alumni and other folks who might actually want to engage in those conversations and what it means for you all's legacy in house. I think those are larger. I hear the concern, and I think it's very valid, and it's definitely something that has come up in the past years. I would say that how we have that conversation is maybe at a little bit of a different time. Yes.
So you mentioned earlier that our kind of right now, as our options stand, we have either we go back to the sleeping porches or we increase the amount of people to a room. What process do we need to go through to create more options for us? Like, who do we need to talk to? What do we need to advocate for? What would that process look like?
So let's talk to me right now. So I am open to other ideas. I'm open to you all emailing me or telling me today what are some of your other ideas if it's not increasing bed space. And so if the timeline is that, for example, if I walk away today and folks are saying that we absolutely feel we can't do sleeping porches for the 22-23 academic year, I will take that information back to my supervisor. And so the question may be, okay, so no sleeping porches, but we do have a wait list of people who want to live in Miller and Watkins, who also have the same issues and concerns that you all do. What can we tell those folks if that's not an option at that particular juncture? So the question becomes, when do we move beyond? Is it just the semester and then we move beds in winter? We've got to kind of, I'd like to walk away with a better timetable than no until COVID's over, because I don't think we're going to have that definitive of a case. I can also share with you is that similar to the years before, if COVID takes an upswing before you all return, we will go back to the individual rooms and reconfigure and re-engage differently that way. It is not what we want to do, but if it did take an upswing, we wouldn't keep rooms and porches. I can also share that the Pandemic Council, the Douglas County Council, all of the folks who make CDC and engage with guidelines for the institution, for the county, are aware we're moving back to sleeping porches. So this has been an informed decision with folks around that table. It's not discouraging you all or saying that we're not hearing you, but this decision was not made in a vacuum or a. Does that make sense? We did consult folks. I'll take your question, and then I think you had green, very Patrick.
Okay, so I have just a statement and then a question. So my statement is, if we're sleeping in the sleeping porches with no masks, or I guess it is a question, how is it okay, like what makes it better that we're wearing masks around the house while doing daily tasks? I just don't see the logic on that.
You all can wear a mask while you're sleeping. We're not going to tell you you can't.
That was not her.
That's what I'm saying. Like, if you all want to do that,
I
but the piece
Don't
is
believe
that
that was the question.
It's,
I don't think we're trying to advocate for masks
Like-
being worn while sleeping.
no, that's not what I'm asking. I'm just saying that, like, if we are sleeping without masks, like, how is that gonna affect us wearing masks in the house? Because we're already pretty much breathing on each other. So, like, why are we still wearing masks in the house when we're sleeping without them?
So I think, again, that goes back to whether or not we have a mask mandate to begin with. And I can't say right now if we would have in August a mask mandate. I highly think we're not going to have one.
Okay. And then my second point is, for the options program, I'm a freshman. I moved in with the options program. In order to move in early, I had to show either proof of a negative test or my vaccination card. How is that any different than making people test when they move in as well? And then keeping it up to date, because options program has like 300 to 400 students that do that every year. So I'm just wondering like how that's any different.
Yeah, so the difference is that that was a university policy. Every student was expected to upload their vaccination information. We specifically in housing held people accountable to that through move-in. So if that is supported and you're at a larger institution to require people to upload their vaccination pieces, then we will keep that policy. But if it's not something the larger institution is planning to do in regards to requiring vaccination, again, it goes back to the question I answered earlier, is that housing can't make up its own policy about COVID in that capacity to require. And so I think if we were going to do pre-testing at move-in again, and again, we did it in August, not in January, only for brand new residents. And so again, we're talking about helpful in August, what we know in August versus what we know in January, completely different scenarios. And so again, it goes back to housing does not run testing sites. Housing does not engage in any of those ability to send tests out. That is a larger state and university piece. So we've got to have support in order for that to happen. Does that make sense?
Yes.
I'm not saying we can't. I'm saying what is happening now would have to be a larger university initiative. So it's very hard for me to say, yes, we can't do that. Don't know. Yes.
It's just incredibly frustrating to sit here and hear that you hear us when we are all clear saying, please, if anyone disagrees with this, please correct me, when we are all saying no sleeping porches. And so I don't think that's something that needs to be questioned. I think we all are saying no sleeping porches. And I can't agree with the justification that we can put all of our housing priorities and necessities as well as our health and safety over finances. And you mentioned that there's people on the wait list, you know, people like us that want to be, that want to live in Miller and Watkins because that's their only option. Aren't you saying then that if we were to capacity, there would be no people on the wait list? You would get absolutely everyone?
Typically, we have in the last couple of years gone completely through anybody who wanted to live in any of the halls.
Does Miller have empty rooms?
Yes.
Yes.
Yes. Does Watkins have empty rooms? Yeah. We do. Not completely empty,
We're
but
not
we have
full
spaces that we
capacity.
can.
Yeah.
So
We're
we're
not
not
full capacity,
We're
has
not-
limited
Yeah.
capacity.
So I think, again, beginning of the year, when people are choosing versus attrition, when people decide that living in individual scholarship halls, all of the scholarship halls have openings. Where we lose, and this goes back to the question of can we wait until June or July to allow people to opt in later? That is where we, if we don't fill early, people don't have the choice and they make different choices. One of the things that's also hard is that folks do not necessarily, there isn't a big market for individuals wanting to switch over to come to the scholarship halls this semester. And that's where that wait list would be for folks wanting to leave the residence halls and come over to the scholarship halls. So we're talking about two different pockets of people. Typically, you all start out very robust and full. And then we see a little bit of attrition, but we see that in all of our buildings. Okay, I'll take your question in just a minute. I think in the back you haven't asked the question.
Yeah, so my personal situation, I was in the UK last semester and I had to cancel my housing contract with Miller when I left. And then when I came back, I had to recontact housing to get back in. I was not made aware that there was a waiting list. I did not know that. So if anyone was on the waiting list, I'm very sorry. But I did not know that there was a waiting list and I was not told that I was put on a waiting list.
I second that. I moved in the middle of the semester and there was no waiting list.
So again, it's dependent on the year. It's dependent on the time. The waiting list is movable. It's dependent on when you all contract. So if someone came to us today, we have spaces. There is no waiting list. If someone had come to us in, let's say September.
I did.
You came to us in September. Great. We probably have one or two spaces. That's different. So again, spaces is different. But I don't want to drop down the waiting list because I think that's contrary to what we're trying to figure out. So let me kind of bring us back before I take some additional questions, because I don't want to belabor or make you all sit through roundabout conversations. So, what I'm hearing is that you all can't do sleeping porches. Can I just get a show of hands? Who is saying no to sleeping porches?
Are you asking in general or for the upcoming year?
For the upcoming year.
If it's safe, Watkins is fine. Watkins is fine with sleeping porches. If it is safe.
This is Miller.
This is only one.
Yeah. And one walker. Two.
Okay, so put your hands down. Let me react this. So, let me react this. For next year, regardless of the status of COVID, who is not wanting to do sleeping porches at all next year? Regardless of the status of COVID. And you all are all Miller. Okay, that is helpful to know. Okay, hold on, before I take the question, I just want to do another protocol. So my next question is, if COVID, give me some, because again, safety is subjective. We've seen that with COVID. If we were able to put together and say that, well, let me ask you to you all this way. Does safety, by show of hands, means that the pandemic is over? Show of hands.
Right. I didn't understand the
I'm
question.
sorry.
So, does safety, when you all are saying it needs to be safe, and I'm putting that in quotes because it's not definable, not really. So, for safety, would that mean that we have said that there is zero ability to contract COVID?
No.
No.
It's not
No.
a feasible thing. It's not even feasible.
I just want to
Minimizable.
make sure that I'm on the same
Minimizable.
page in regards to what people are saying for safety.
There's no zero chance of getting a common cold.
So again,
Yeah.
so what I'm saying is there's a difference between you all having what your safety, what level of safety, that's what I'm trying to get at for folks. So would safety mean, in order to get back to the sleeping porches, that there were no mask mandates on campus? Is that your version of safe? Show of hands.
I believe that, speaking for Miller, I
Sure.
believe that safety is that COVID has been managed. There is properly, so the university does percentage of vaccinated students, right? Yes, because it's been put out by KU today.
So there's been no vaccination mandate.
Yes.
Well, I'm not saying mandate, I don't want a mandate. I'm saying we are made aware of how many students on campus have actively told the campus, hey, I'm vaccinated. We have that information.
Okay.
So I feel like the safety has to be around, one, the entirety of, maybe the state, probably the entirety of the US has managed COVID properly, like it has managed Ebola, the common cold, where we're not getting it and then we're not dying of it. So it is, by managed properly, that's what I feel like our safety standard is.
Okay, that is a very high standard, that is helpful to know.
High standards.
Another question that I would like to ask is, if you all, again, if we take the word safety, if we were able to look at our policies or find some way to give you all the information that said, out of X number of people, 100% of you all are vaccinated, would that help alleviate safety pieces or concerns for you all?
Housing has told us before that that is a HIPAA violation because we did try to get not vaccination of individual people. We have tried to get the percentage of the house. So we
what
were
I'm
told that's a
saying is,
HIPAA
if-
violation.
I get that, and it currently is a HIPAA violation, and what I'm saying is, if we were able to find some way, shape, or form, if that is what made people comfortable with sleeping porches, could that tip the scale, yes or no? Vaccination, understanding of the house. Show of hands, yes or no, would that tip the scale for sleeping porches?
If you guys could get 100% of people vaccinated,
Sure.
that is unrealistic, but yes.
Well, I think what she's saying is that if we can see the results of how many people are vaccinated in the hall, and if it's up to the standards that we are okay with, then we would be okay with sleeping porches. Is that what you're saying?
That is what I'm
Yeah, so it doesn't have to be 100% unless that's our standards, but if it's 90% and one person isn't vaccinated or something, if we were okay with that, we would allow sleeping porches again. Is that what you're saying? Like being able to see those results would be important to us, right?
That's what I'm asking, if
yeah.
people can share more clearly
And I think so.
vaccination status.
Yeah.
But that's a HIPAA violation.
Again, I'm saying
just
that
said
there
we
are opportunities where if we ask some questions based on Miller and Watkins and you all's unique sleeping pieces, can I, between now and August, see that as a possibility? If I knew that it was important to you all, yes, possibly. So help me understand if it's important to you all.
Yes.
Yes.
Yeah.
But you
And
can't
does that-
get that information. You can't change HIPAA.
But we have to give a picture of our vaccination cards. We don't have to, but we are strongly encouraged to register that with Watkins Medical Center.
Yes, but the HIPAA violation comes in where we all know the percentage.
Or it's actually specific people.
It's specific.
Yeah.
Say,
That's why
say
the
you're
percentage
vaccinated, but
is
Riley's not. That's the violation, is knowing directly who, not necessarily a general population.
Got it.
I think
Got
we'd
it.
figure it out. I have
Got
a
it.
feeling.
Either way, what I'm saying is, by show of hands, sleeping porches, if you all were able to better understand vaccination status. Show of hands, you would do sleeping porches.
I don't.
Okay.
If,
Okay. Yes.
I just have to say for like Watkins, he asked us what maybe like we thought would be safe. Like I feel like if you ask me, that might be different than somebody else. I feel like it might be better. Like I don't want Watkins to say like now what we think would be safe. I feel like it'd be better if we could like go back past our fall, since it's only like a couple of us here now. Okay. But I did want to say that like Watkins, like from the people I've talked to, especially like people who have had the sleeping porches before. Like I just, because I do want you to know, like we do want them, and we like them if, like we said, like if it's safe. But you, like you said, it's safety is subjective. But I think that conversation of what safety is might take a little bit longer than this right now.
And the conversation of safety kind of comes back to our very first question of what our COVID plan is. Like, for instance, Maddie Wiseman, she's one of our older girls, she's lived through this, she's had the sleeping porches pre-COVID. When they would get sick in a sleeping porch, it's really annoying to hear people cough. And what they would do is they pulled them and they put them in our common spaces. But that's not fair for us that want to watch TV. That's not fair for us who want to study in our, because we have an actual study room.
Actually, if we wouldn't, you would just do it yourself. Well, you would do it yourself. You wouldn't be moved there. Like somebody wouldn't put you there. It would just be kind of like yourself. Yeah.
But I'm saying that if that's something like, and if our girls went to J-Rock Tower, and not that it's not an uncomfortable thing, it's not our best motivation, and it's something like, even like some people are not willing to get tested by Watkins because they don't want to get moved out. Like this is a genuine, like, yeah, some people are getting tested by Watkins because they don't want to get moved out of their house. We just want to have a better, like, maybe that not be the only option is J-Rock Towers getting moved from our, not just J-Rock, but not getting moved, really trying to figure out a better COVID plan. That's at least where we're coming from, is we want like some like more solid, like, what happens if, what do we do if, and it's, we understand that the CDC has their own guidelines, but you can be asymptomatic and not, or asymptomatic and still have COVID. It happens. So we want kind of a more in-depth than just the surface level of this is what the CDC says for us to
So
do this.
our COVID plan is on the website and we can walk through it, but at the end of the day, we are in the process of dealing with positive folks. That is what the CDC standard is for university guidelines for on-campus housing. So if someone tests positive, and this gets back to your initial conversation, is that we know that we're having a societal issue with individuals not wanting to test. So we rely on community members and people stepping forward. So I can say as someone who's dealt with this for the past 2 years and individually talked to folks are in our hall communities doing their part and telling us when something is not feeling right and engaging. So we move that particular person, or we allow them to go home, or really make their own decisions in regards to next steps. I don't see that process changing. I don't see that changing at all for quite some time. We're still going to isolate positive people.
Yeah, for sure, absolutely.
What becomes very tricky is where someone who isn't vaccinated. And again, this kind of dominoes down as to we don't know yet what the university policy and procedure is going to be for vaccination. And again, willing to advocate and suggest, but I can't speak on that right now. before you make your room selection.
Because that's a real, like, like you said, like, it's it's really impactful to know what our capacity is.
Yeah, I
Especially
hear
if
that.
we're staying in our rooms.
I hear that, and I think that we can work with each hall independently to make some of those decisions. And it sounds like, again, as we're kind of going through this conversation, communities are in two different places. And that's okay. I think we've got some time and capacity to work with individual halls to figure out kind of what is the next step. So saw a lot of Miller hands.
Okay, so since you have mentioned that both of us halls are in different places. So if housing happens to come up with a safe enough solution for Watkins, they have expressed, if it is safe and to their standards, they are willing to go back to sleeping porches. Miller has expressed no.
Correct.
So to kind of come to an almost a little agreement, why don't you have walk-ins if it is up to their standards and to their safety and what they want in their hall to have sleeping porches?
I think now
And for Miller to not have sleeping porches and kind of see what it looks like if
With the waiting list.
Because, I mean, we understand that we're sister halls, but we're not
The same.
right.
We're not-
And if they want to do it, who am I to tell them no? So
And
if they want
that's
to do
what their
it,
safety is, then all of us respect that for their safety too.
I get that.
We don't, like, does it have to be that we're co-joined at the hip that we do
Right.
the same thing?
I don't think so, but I think I can take that back as a possible compromise to see if there is capacity where we raise it a little bit, we reach some standards, that type of piece, and then we treat you all separately. I think you all were given the information at the same time with the expectation that we had worked through that what we did previously in regards to making changes, because you all, the best way to put it succinctly is that when we're talking about health and safety, it is very hard when the living situation is very similar to start microing out. That's why we didn't at the beginning of COVID, and we said everybody, with the exception of you all being able to keep your kitchens, we had everybody do the same thing. I think because we've been living in COVID for the last couple of years, I think we can start to find nuance where we haven't before. So I think there is capacity. Couple questions. We've been meeting for almost an hour. I want to be respectful of people's times. So if you do need to head out, I'm more than willing to stay here and answer questions. But I can summarize and tell you what I will be sharing and continue to ask questions. So are folks good to continue the conversation or? Okay, I will continue then. Questions? Yes.
I just would like a clarification. You said that masks are required in like bedroom areas.
They are not required.
Or no, not on, I'm sorry, I messed that up. It's not required in bedroom areas. So like the sleeping porches, like the entire porch or just the bed is your sleeping area?
So great question. So it would be what I would clarify as the entire porch.
So we can stopping 25 girls from, or 25 people from congregating in one area.
You tell porches, you're talking people.
The sleeping porches are dark.
Yeah.
It's just.
No, it's
okay.
Okay,
Yep, and I think
Harry just wants to sleep.
some of the questions in regards to, there are some people in this room who've never experienced that and don't know kind of the rules and regulations that are set with the porches. And you all do a fabulous job of teaching and giving those rules and regulations. That's why, again, you all were the only people that we said you can cook during COVID. Do you know how special you all are and how much trust that comes? We didn't let anyone else do it. And so we trust that we're going to land somewhere with you all where we can figure out a compromise. Yes. And then we'll take some questions.
Oh, I forgot my question. It was just if we are going to do the second option where you go through and you decide which rooms get tripled up or two beds or whatever, could you tell us beforehand and then us decide whether or not we would rather have sleeping porches? Like if we were like, okay, these rooms are getting too crammed.
Yep, so I think what I see happening, if we're gonna do that walkthrough, is that I'll work with them to get a couple representatives, probably the hall president, VP, whomever makes sense, We'll go through, we'll do some walking through, we'll mark up the floor plans, we'll give those suggestions to our facility folks. They will give our suggestions back. We'll go and talk to the fire marshal, all of those good things. And then before you all do selection, you will make sure that you all have that information.
We've already done room selection for Miller.
Since it is coming up next week. And
Yeah.
we are very busy people and we had our house
At our
meeting.
available house meeting.
Okay, so you all have already done room selection. We can work with you differently. Okay, yes.
I was wondering if because we are wanting to have a clear definition of what safety is if it's possible to continue to just essentially monitor the status of like COVID spikes. At least in my head, I'm seeing safety as there is a lack of spiking. So it is at a consistent downfall with cases, and there are no major spikes. Like, I understand that it's going to continue to mutate, just like the flu does. But at the same time, I feel like a general statement of safety could be found from watching the trend of COVID and seeing if it can consistently go down rather than having all of these outrageous spikes like we've had.
So I think there's a couple of pieces that are important for you all to kind of understand is that there are campus trends and spikes, and then there are Douglas County, and then there are national pieces. So as it relates to the campus trends and spikes, we haven't really seen a spike. Even with Omicron coming through, there were larger cases, but not nearly the number of cases. And I'm talking specifically housing cases. We saw a small spike, not a giant spike. So I think, again, we have to better understand when we say spike, what does that actually mean? And I'm more than willing to kind of sit down and talk with you all, but we would have to, and makes it a little bit harder because you all are here right before you move in August, and so we wouldn't have data to understand what would happen post-August, and so that's why we kind of have to project or think about ahead of time versus waiting until August. And if it's again, going back to, you all clearly don't want sleeping porches, we can't really project at that point or spend time projecting if that doesn't really matter at the end of the day. Because we wouldn't be able to flip spaces in August.
Well, here's what I'm saying. So since we are wanting to go another year with sleeping in rooms and not sleeping in porches, we then are able to use that time plus data that we've been accumulating for the past couple of years on the multiple levels that you've talked about, both universal, county, and state. If we're able to use all of that and see, and I don't know who exactly would get the numbers.
We have access to the numbers, and what I'm telling you right now is that you all aren't spiking. You've never spiked. So does that make sense? For Miller and Watkins, if you just took your halls, you've never spiked, and you've never had what I would consider major issues or concerns. So I don't know necessarily if that data would tell us much in regards to, particularly if you all were still in the same setup.
Well, what if we honestly did comparative data between them going back to sleeping porches and us seeing if it makes an awful huge difference, if it's a huge increase in spikes like it has been since reinstating kitchens and other scholarship halls, which has caused spikes in other scholarship halls to be together, at least in large amounts. If that could be done within the 22 to 23 year, if that could almost provide some security to us Millerites that going back to sleeping porches could be okay for our health and it wouldn't kill our people with autoimmune diseases or immunocompromised.
Okay, I understand what you're saying. Thank you. Yes.
Because I don't think that Zoe was specifically talking about Miller and Watkins data on the spikes. We do want to kind of look at the university data because we were talking about this earlier. Miller has had one positive case within the hall. This isn't considering breaks and winter break or summer break. Since I've been there, which was at the start of COVID, and even now, isn't Stevenson having multiple cases a week, and they are they eat in the same room, they have these things. So obviously what we're doing right now is working for us. And we want to continue that. I was gonna ask a question about is raising capacity the only option that we have right now? Is that the only option that Miller or Watkins has? And so we just have to find a way to do that, even if it's not sleeping porches?
I think the goal is to get us back to pre-COVID numbers. If that is a slow trickle versus a full wave of going back to sleeping porches, then I think that we can compromise. So for example, I think what I heard is that Miller, no sleeping porches, Watkins could be open to it with a couple parameters. That in turn, if we look at both buildings together, raises capacity in some way, shape, or form. Does that make sense to folks? So
Yes.
there is compromise in that,
Right.
which I can take back to others and say, hey, is it not 100% capacity at this point like we would want, but can we get to 75? Does that make sense to folks?
I think that would be really appreciated for most of us.
Yes, I think that's
Because
perfect.
25, because I think our capacity is 35, right? 25 new people immediately is a ton. Sleeping porches with COVID, rooms with COVID. It's no matter what. So I think if honestly, at least our vote, I think would probably, slow trickle seems like a very good compromise on our end at least.
Slow trickle while still in individual rooms, or slow trickle with sleeping porches? Could we do a slow trickle with sleeping porches?
It really just depends on what the COVID cases are when we move in next semester.
If it
Like,
was
if
one of
it's terrible, like it was, like how it spiked over winter break,
Then slow trickle in rooms.
Yeah.
But if it's something where it's, this is okay to Watkins, because I know that Miller does not want to do this, but if it's something where it's, COVID cases are better and we are feeling better about things, then yes. But I know that like in housing for like at least like my year, I don't know about you guys, but I didn't know there were sleeping porches when I signed my contract. So I called housing like 4 times during the summer to see if we were having sleeping porches due to COVID. And I don't think they actually told me like a true yes or no until July, which I think is around orientation time.
Yep.
So if that's something 2 months out, granted, yes, there might be a spike, but at least at a later date deciding yay, nay.
Okay. Yes.
I think, this is not to do necessarily with the sleeping porches or the rooms, but with housing staff, because we've had multiple problems with communication and compromise with housing staff. People who have moved out haven't been able to cancel their contracts. They still have to pay even though they're not living there. I can name 2 people off the top of my head. And they've been in contact with housing. There's been frequent emails back and forth, calls, and persistently, there's been issues with compromise and actually having them listen to us. So how do we know that you guys are going to keep in contact and actually compromise after this meeting?
Sure, so a couple of questions.
Because it was announced already in the Miller website
What was already announced, sorry?
that there's gonna be sleeping porches.
Before we even.
Before we even knew.
I need to get these up. Sorry, I'm on call. Okay, so, couple of pieces. How housing works. I am the res life person. So I am the people in the buildings, the UG staff, your food board managers, Ben, the proctors, the people, and the things in the house. Does that make sense? We have a whole other branch that does canceling of contracts, engagement on signing roll-up for rooms, all of those different pieces. Then we have a branch that does facilities. So if you've got a leaky toilet, we've got people that do that. Each one of those have a different associate director. What I can do is, I'm not sure of the situation where people are trying to cancel their contract. What I can tell you point blank is that there are some very stringent rules for when people cancel their contract. They have to no longer be a student here, or they have to have a medical exemption or a military exemption. If it does not fit those 3 criteria, then they are typically paying a housing contract cancellation fee. there are instances where we made exceptions based on dire situations. What I can tell you is that give me the name, I can look into the situation if that person is still struggling. You can email me, I have some business cards, thank you, Kimberly. Okay. And we'll personally look into that, contact that person, but the person has to want to be engaged. So I don't want to engage on someone who feels like their situation is already done, but I can ask some questions and better clarify and engage with that person. See me afterwards, and I will give you my contact.
I would like a card for my own communication, but also to see if it's an option, because I'm not gonna give the name without the consent of the individual.
Yeah, so if you want to talk to the individual, do that ahead of time. I'm happy to discuss as to ensure more information about why they weren't able to get their contract before. I do that quite a bit for other folks and other people. But what I can tell you all is that if the individual put in their housing contract cancellation and it was denied, there should be a reason in that email. And if they don't understand the reason, then it's an engagement with our office, and I'm happy that if they haven't gotten the level of engagement they need to look into it.
Thank you.
Yes.
So, per my earlier question about who made this decision, you said it was like a miscommunication with Sarah Waters. So I'm assuming Sarah Waters had something to do with the decision-making process?
So I think it's a housing decision which would be inclusive of all of the housing of our management, which would be inclusive of myself, Sarah, Jackie McKinnon, who oversees occupancy, would be 3 names.
So, two full questions here.
Yep.
I appreciate you being here. You're taking kind of the blow for the other half of you. So why couldn't the other people be here? Because it seems they have a little bit like a different side than your purpose here. So why aren't they there or here talking to us now?
Yeah, so I think Ben and I wanted to put this meeting together as soon as possible, so we had the availability with ASHC happening tonight. I'm the co-advisor for ASHC, so I was already going to be here. So that's why.
Okay, and my second kind of question. So if, let's say we can't come to a compromise, that might be a really real situation, and Miller is asked to have sleeping porches back. I guarantee we have 25 people returning, and I guarantee you about 20 of them will leave. So that makes up the majority of the house being incoming freshmen. And like Watkins has said before, they didn't know there was sleeping porches when they signed their contract.
Well, that's just because I'm stupid, but that's a.
Okay, but like,
I didn't know either when I signed
housing
mine.
website, and finding something that actually depicts what sleeping porches is really hard to find. I was looking at room layouts, floor plans, all sorts of stuff when looking into scholarship halls. I signed up for Miller because of the kitchens. I didn't know that we all slept in one giant room like it's a slumber party.
I did not know either. And I would also like to bring to the attention that there is a picture of Miller's sleeping porch on Miller's site, and you can visually see how cramped it is.
Yeah.
So I guess my question is, how are you going to ensure that these incoming freshmen that are probably going to fill the spot of returners that don't want to come back, how is housing going to reassure that it's a safe environment? Because I guarantee you will get angry parents. You will get angry students.
So I think it's going back to some of the communication we had earlier. So pre-COVID, orientation was in person and people were able to do tours. What we've also done post-COVID is do a lot of filming and put some things so that people going through orientation will be able to see it. What we're still trying to learn is how that information is getting out to those individuals, and we need to do better work with orientation to find out people getting access, but all of it put into a folder that students should be able to, and their parents, access those videos. And so I think we'll continue to build that, as well as in-person makes a difference with orientation. It makes a huge difference.
Okay, a quick follow-up. That folder that you mentioned, where me as a student, where would I find that at?
So the folder's through orientation, it's through your orientation process.
Okay.
No one mentioned that to me during our whole orientation.
Well, that's good to know. We'll share that feedback with orientation because it should be.
I was never informed of any of that.
I had an orientation online and wasn't informed of anything
I
about it.
had it in person, I wasn't informed of that, I didn't know.
If you were in person, it's a different setup.
Okay.
So you should have been able to do a tour if you wanted to.
So to comment on the in-person, I was here pre-COVID, took my regular little walk around orientation, and I was also not made aware of this.
Of
This
tours? I
is
second that.
this is 2018.
So you all weren't told that there were tours
Correct,
that were
correct.
Okay, we will continue to close that gap with orientation, but every single orientation session, we offer tours. We offer tours of the scholarship halls, we offer tours of individual halls, we offer tours during the academic year. Every,
There's 1 to 5 right now.
1 to 5. So people have vast opportunities if they're on campus to see the individual halls, but we can always do better in regards to getting that information out there, and with our partnership with orientation, I will give them this feedback. Okay, so what I'm hearing is that we've got kind of 2 different branches here. We have some pieces where we need to spell out safety concerns either way. What people are most, it feels as a viable option is that if we needed to increase capacity, that we do it in a slower amount, maybe not 100%. Show of hands, is that a fair assessment? So people are not, put your hands down, thank you. So people are not sorely against increasing the number of people. Is that a fair assessment? Yeah. Okay. It's just the number of how many we increase and the curve of COVID. Does that make sense to folks?
Yes.
Yes.
And is that a fair assessment?
Yes.
Yes.
So if we put together 2 different scenarios that showed these are kind of the different pieces that need to happen in order for us to get back to sleeping porches and get to capacity in a timeline, we gave that to you for you all to talk about. Would that be helpful?
Yes.
Yes.
Okay. The other piece is, we will work with occupancy. I know you all mentioned that you've already selected spaces. I will take this information back to our occupancy people and ask, based on what you all have shared tonight, what that looks like. I understand you're busy people and you don't want to redo anything. We will work to make sure that it's not intrusive of whatever next steps we need to take if we go in the direction of needing sleeping porches in all of the different spaces. The other thing it sounds like is that there could be, regardless of COVID, some larger picture conversations, particularly for the Miller people, about sleeping porches in general. Is that a fair assessment?
Yes.
So I'm going to separate that piece out for right now and focus on this upcoming academic year because that is the one that is most pressing. So I want to make sure that I have answered and addressed your questions, and I will talk about next steps. Any more questions? Okay. Ben took some, I'm sure, diligent notes, and we'll be working to get those to me. I will meet with our folks, with my counterparts in housing, take you all's feedback, and engage with next steps. What I would ask for you all is give me time. Give me till the end of the week, Monday maybe, to give you all an update and give you and put that plan together. So hold on just a second, I'll grab your question. The other thing that I ask is that if you still have questions, I'm asking you to communicate directly with me or with Ben. Emailing the housing email is only going to be forwarded to myself and Ben. So communicate with us directly. And I understand if you all didn't have that information or that context, let me make it crystal clear for you all. Ben first, or both of us together, or me only. Either one of those things will get you a response. And I meet every single Monday. We spend a good hour chunk together every Monday talking through things. So my hope is that if you've got questions or concerns, you now know your resources of how to get those different pieces for this topic. If there are underarching things, that's where your SHDs come in. That's where your undergrad staff come in. Make sense? My biggest piece, I know you all feel strongly that we never communicate with you all. I am in your halls every Tuesday. I am in your halls every single week with ASHC. That's where you can find me, Tuesdays at 7, wherever ASHC is. So if you've got memos, messages, any of those stuff, my door is open. It always has been for the 6 years that I've worked here. So if you need to come and vent or whatever it is, we want to get your problems fixed. I can't wave a magic wand or anything to get everything fixed, but it's not helpful if you don't know or if you feel like a message has stopped somewhere. The staff, myself, Ben, we're human and we make mistakes. And so what I need folks to understand is that I think my staff never does anything intentionally, and I'm speaking specifically for the food board managers, the proctors, the SHDs. We're all just trying to make this the best situation for you all that we possibly can. And sometimes we do get that wrong, and I get it, and it's impactful. What I'm asking is for enough information so that we can do something differently in the future. But in order to do that, I need you all to tell us. And if it's not coming through in the way that you need it, I need you to blow up my email, not the housing email. Make sense? Okay. Yes.
So I know you said you need time, which is very fair. How should we expect to get you and your coworkers' conclusions communicated to us?
Yep.
Because I thought it was very poorly done that we essentially heard that sleeping porches were forced to come back through the grapevine. There was no email sent to us directly.
So probably what we will do in this next iteration is either I will pull you all together for another meeting and come to one of your Sunday night meetings, or do you all meet on Sundays or Mondays? Sundays and Sundays. So myself and Ben will either split a Sunday meeting and come to each individual, or we'll work that way. If we feel like it's succinct enough to put it in an email, then we'll do that. But I think there's also pieces where, again, we find out we'll communicate via email, but there's tons of questions. And so it may be email and then follow up in your Sunday meetings. It just really depends on how in-depth we need to go in regards to the communication to you all. Yes.
I completely understand that you'll need time to kind of come up with some sort of plan or a compromise, but you did mention earlier that if people living in Miller or Watkins aren't comfortable with the sleeping porches and want to move out, we have to let you know by February 20th if we want to be put in a different scholarship hall. Is that what you said earlier?
I think we can compromise if we can't find a good lane where people feel comfortable staying in the space, that we would stretch that timeline. I can't promise that. I'd have to talk to my colleagues, but I think that there is an ability to have that discussion differently if we find out that there are multiple people that do not like whatever compromise we land on.
Okay. Okay, so that would be extended past the 20th then, possibly?
It would be in the email communication, or in the next meeting that we have, I would update when you all would need to tell us that you don't want to live on campus.
Okay, okay, that answers my question. Thank you.
Yep. Other questions? Okay. Do we feel like we're in a good place right now? And by good place, do I feel like people can leave here, not have questions, and feel like you were heard? Not a solution. I don't have a solution for you right now, but do you feel like you got your say in this? Okay. Right. I will hang out for a little bit after. If you want a business card, I think I have 10 or so with me. Otherwise, my contact information is on the website. Appreciate you all giving the time tonight. If you got questions or concerns, please let me know.